As the healthcare leader of the Tri-Parish community, Terrebonne General Medical Center is a nationally recognized facility providing state-of-the-art technology and advanced services. Terrebonne General compassionately provides the most services responding to the greatest needs for our community. All right, welcome back to Bayou Time. As we do each and every Wednesday night, we're going to talk to your health with Terrebonne General Medical Center. And joining us now, if we could take a look at our guest, on your left is Dr. Hector Linares. He is the Physical Medicine and Rehabilitation Doctor at Terrebonne General Medical Center. And to your right is Nancy Dupre, the Director of Rehabilitation. And tonight we're going to talk about American Stroke Month. And if you saw the show tonight, they can help me. Right. It is American Stroke Month, and Dr. Linares, why is that so important to get that message out?
It is important because stroke is one of the leading causes of death in the United States of America, and because it's also one of the diseases that leave us with more disabled people on a every year basis. We have to deal with the sequela of the stroke, and here at Terrebonne we have a very fine program to recover people who have suffered from a stroke.
By the way, I love that accent.
Thanks.
All right. And also, you know, you always hear about factors that increase the probability of stroke or that thing, and you hear so many different things, but what is it? Can you narrow it down for us?
Yeah, to make it simple, basically there are 4 big factors that contribute for a person to have a stroke. Hypertension, high blood pressure, diabetes mellitus, lack of exercise, and too much food. Basically, those are the 4 largest factors that can affect you in a way that eventually you can have a stroke.
Did you say too much food?
Too much food. Too much good food in
Louisiana. I thought I heard you say
South
that.
Louisiana, you know.
I thought I heard you say that.
We have to live with that.
Nancy, what are some of the common signs and symptoms? You also hear a lot about that, and people who have had strokes will tell you, and sometimes it varies a little bit, but
it
what
sure
are
does.
they?
Some of the signs and symptoms can include, it's usually it happens quickly, the onset is quick. You would have like a severe headache. You would have a quick onset of numbness or tingling. Usually it's on one side of the body, you know, the face, the arm, and the legs. The person might have difficulty speaking. They might have slurred speech or can't speak at all. They could have blurred vision or loss of vision in one or both eyes. They might have difficulty walking. All of a sudden they have difficulty walking, or they'll lose their balance. Those are a few of the signs and symptoms.
All right, Dr. Linares, let me get back to you.
Go ahead.
In the event of a stroke, I mean, what is, I guess this could be a 2-part question. Somebody who's having a stroke, it could be a different scenario than somebody who's seeing somebody have the stroke, but what do you do in the event of a stroke?
Correct, but either way, if you are able to get a cell phone or any kind of phone, call 911. If you or somebody else that you are seeing is suffering stroke, the signs and symptoms that Nancy just mentioned. And it is important because you have to see stroke as a brain attack. Just the same way that you treat a heart attack, that's the same scenario. If you don't go and receive medical attention soon, you're gonna have more consequences, more very difficult consequences to deal with.
Okay. Nancy, we talk about accreditation quite a bit, and a lot of people in the audience hear about accreditation, but they're not quite sure what that means. And there's always a acronym to go with it. What's your acronym, and what does it mean to be accredited?
Right, and a lot of people with the advertising, we are CARF accredited. So everybody wants to know what exactly does that mean.
So CARF, C-A-R-F.
Or F, correct. And that stands for the Commission for Accreditation of Rehabilitation Facilities. So what actually happens is CARF will actually send 2 surveyors to our rehab unit, and they'll specifically focus on our rehab unit. And they're there actually 2 days. And they'll survey the unit. They'll look at guidelines that they put out to see how we do compared to their guidelines. And it could range from anything to leadership, patient care, education of the patient and their family members. It could range to family trainings, even continuing education of our staff to make sure that our staff stay up to date on what's going on. So it's a wide range of data that they look at. They also look at what we have different scores to compare our facility to the other facilities to see how we're doing compared to the region and the nation. And just overall, the progress our patients are making from admit to discharge, how are they progressing? And a lot of times they'll even go as far as interviewing the patients, whether it's a former patient or a patient there, when they're surveying. So they look at numerous things, and then the process is after they look at that, you either fail or you pass with 1, 2, or 3 year accreditation. Well, we applied for our stroke specialty program, and we're very proud to say that we passed with a 3 year accreditation. That's the highest you can receive. So we passed the accreditation, and which means that we're really up to par and state of the art with our stroke patients. The majority of the patients we have are strokes. So, and we're actually the only hospital in this region, in this tri-parish region, that has a stroke specialty accreditation, and 1 of 4 in the state of Louisiana. So we're proud of that.
That was a pretty good explanation.
Thank you.
Yeah, sounds like you're very knowledgeable about that, and you should be.
We've been
as
doing
a
that for a
director.
long time,
There
yes.
you go. We're going to take a break. When we come back, we're going to have more with Terrebonne General Medical Center. And don't forget, we got George Caslow in the kitchen tonight, and that's coming up. You won't want to miss it because he's doing something really good tonight. We'll be right back.